Dr. McCray, thank you so much for your time. Why don't we go ahead and start by you telling us how you ended up here at UT and what keeps you here? What do you like about our institution?
Absolutely. So I've actually been at UT since 2004. I was a med student here. I did part of my residency here. I did my second and third year of internal medicine and stayed on for fellowship and then became faculty member. UT was actually my first choice when I ranked med schools, primarily because of the environment. So being able to train in the Texas Medical Center and then also the student body. So I was very drawn to the med students that I met and the faculty. I felt like they were very welcoming, very well-rounded, just unique individuals. And that's how I started here. And that's the main reason I stayed. Certainly we have family and personal issues that oftentimes will keep you in a city where you're training when you're in your late 20s and 30s, but also it was, really UT had become my family. The rheumatology division is my family. I've now been on faculty for over 8 years and very happy with my decision to stay. I can't imagine a better place to practice, especially we see very unique and complicated cases in the Texas Medical Center. And for rheumatologists, that's kind of like our playground. So it's been a wonderful opportunity to be able to stay at UT.
Wow, so many things I want to follow up there, but why don't we start? You mentioned that you were a resident here, and so
Mhm.
I would love to hear a little bit about what it was like to be a resident here and some of your favorite memories. What do you think you took away most from being a resident at UT?
So, I was also a resident at UT Southwestern for my intern year, transferred here back to UT. Both programs are excellent. I think what I loved about UT, Houston in particular, was the exposure to all of the subspecialists. So you have great, exposure to bread and butter medicine through LBJ and Memorial Hermann, but at that time also had more opportunity to rotate with some of the subspecialists. And we have, phenomenal subspecialists at UT. And so I loved having that. I feel like it really helped to polish me my second and third year of training. And yeah, so I think that was one of my favorite aspects of the program. And then, I really did, the faculty and then my co-residents really did get along, really found some of my closest friends here. So I just think overall, it's always been a good fit for me and my personality.
Yeah, that's what I've heard from a lot of people is that their best memories are from their co-residents. And then you mentioned the patients. Could you tell us a little bit more about the different clinical and training environments here and give us some specifics about the kind of patients you guys see in rheumatology that you appreciate so much?
Yeah, so it's Houston is the most diverse city in the United States. It's an amazing place to train. You see all races, ethnic groups, socioeconomic status. You can see at UT, you can see private practice patients, but then you can see our work with indigent care out in the county. And so just having exposure to all aspects, I think, really makes for excellent training. At rheumatology in particular, we also rotate we have a clinic at Thomas Street Clinic, which is one of the largest HIV clinics in the United States. And so that's a very unique opportunity where, a lot of rheumatologists in their training never have exposure to rheumatic disease in the setting of HIV. And so that's very unique opportunity for our fellows. And it was interesting when I was actually interviewing for my fellowships all over the country, I was surprised to see, depending on which region you're in, very little exposure to just HIV in general. And being in Houston, it just seems like that was part of the regular past medical history as you're presenting on inpatient rounds. Patient has hypertension, diabetes, HIV, just normal part of your training. And so I was actually very surprised by that. So I think having that exposure is very unique. And a good opportunity for anyone training here. The residents get to rotate at Thomas Street with us as well. And so they get to learn joint injections and see kind of some unique aspects of autoimmune disease that they may not see somewhere else.
Yeah, and then I know rheumatology is also a leader here in the research
Mhm.
field. So if you could just talk to us a little bit about the scholarly opportunities that residents could get involved with in rheumatology, that would be amazing.
Absolutely. So, our program is unique in that we have the largest spondyloarthritis cohort and scleroderma cohort in the country, which a lot of people don't recognize. And there's tons of research opportunities and scholarly projects that are related to that. So we have some of the world's leaders here at our institution, and they're always looking for interested fellows and residents, to collaborate. And so a lot of the residents do rotate, especially if they're interested in rheumatology. They end up with manuscripts or poster presentations before they even are applying for their fellowship. So amazing opportunities for that. So, there's a wealth of information that they're going through with their different cohorts. And so I think it's pretty easy to find a project that is of interest, if there's an interested resident. We even have med students that get involved with projects, with our group. So there's a lot of opportunity.
And then one of the things that applicants really struggle with, especially with virtual interviews, is trying to figure out if they fit at an institution. So I would love it if you could just describe a UT resident and what you like about them in a few words to help our applicants.
Sure. So the first thing that I generally think about with a UT resident is a go-getter. And we have had visiting students and residents from all over, but I feel like a lot of the UT residents, just personality shines. They are extremely hardworking, for the most part, very invested in whatever rotation they're in. So even if they're not terribly interested in rheumatology, I'm hard pressed to think of ever having a resident rotating with us that wasn't there to learn and contributing to the team. And so I think UT does a great job of recruiting that.
And then could you tell us a little bit about what you like to do in Houston and the things that you enjoy, maybe especially before the pandemic started, but even during the pandemic times?
So it's funny. I moved to Houston from Austin. I did my undergrad in Austin. When I first moved here, I thought, Houston, I don't know how I feel about it. After being here for a few years in med school, grew on me some, came to where it was an okay place to be. And then now that I've been here longer and I've seen the city change and evolve over the course of almost 17 years now, I can't imagine living anywhere else. It's, it's a very large city, but it's not overwhelming, especially primarily where most of the residents, fellows, and people involved with the med center would be living. It's, most people are inside the loop or just outside. So I think I'm drawn to the arts here. So you can't beat being able to go and sit outside in the park and listen to the Houston Symphony play. The museum district is just north of the med center. Amazing exhibits and displays, and there's plenty of things you can do, without having a lot of money, or even they have free museum days. So I think I always love that as a med student. And then the food, everyone's going to talk about the food, but it's pretty amazing. I'm a foodie, so I love to go out to eat. You can find just about everything here, depending on what part of town you're in. And so I think, on your days off or when you have some downtime, there's plenty to do in Houston.
Well, thank you so much. I really appreciate your time. Is there anything else you think our applicants need to know in order to make a good decision? Anything I've forgotten to ask you?
No, I think it's just, when you're interviewing, you're going to get good training in a lot of places. So really just try to ask as many questions as you can, especially with the current residents, fellows, and maybe even junior faculty who are not that far from training, just to get a feel for if your personality really meshes where you're training. So I think that's a huge part of it. You need to have your strong support group, and that's going to be who you're working with. I think at UT, like I said before, they do a great job of recruiting kind of well-rounded, individuals. And so I think for a lot of people, it is a great fit. But I think just make sure you ask plenty of questions, especially to those people who are not that far from training or currently in training, because I think that's where you'll really get a feel for the environment.
Thank you so much.
Absolutely.